I'm going to be doing my long-awaited neck exercise routine. We're going to be strengthening the muscles in the front as well as in the sides and stretching the muscles in the back. I've noticed that with my patients that when they do these exercises that just 3 or 4 times a week makes a significant difference. You can reduce your neck popping as well as your neck pains. So really good ways to relax muscles are massage, stretching, pressure, and reciprocal inhibition. Reciprocal inhibition is where you strengthen the opposite muscle group that you're trying to relax. So a lot of times the muscles back here become really tight because a lot of what we do is in front of us. So you have to stick your head forward, or you don't have to, but a lot of people do this. You have to stick your head forward sometimes when you're on the computer like this. And as you're typing, these muscles have to engage to keep your head up. So heads are heavy. They're about 10 to 12 pounds on average. So that's a lot of weight for your neck extensors to have to hold up. These are your extensors, these are your flexors. So these extensors get really tired and tight from having to hold up your head if your ears are in front of your shoulders. So you want to keep your head back so that your ears are directly over your shoulders. And then also if your computer is down, you want to bring your computer up to eye level like this. And then now you can keep your neck muscles all balanced. But say you weren't doing that and now you've got a problem with muscle imbalance. These muscles get too weak and these muscles get too tight and strong. So we're going to be rebalancing all that. So with the reciprocal inhibition, you strengthen these muscles to relax these muscles because they work opposite each other. So you've got your neck extensors trying to hold your head up, and also when you bring your head up like this, and your neck flexors keep your head back and also tilt your chin towards your chest. So we're going to be doing a lot of work on strengthening these and relaxing these for today's session. So we're going to get started right away with the first exercise, which is upper trapezius massage. These muscles tend to get really tight from shrugging a lot. So what we're going to do is just apply a massage technique to the tops of the shoulders to help reduce tension there. One way you can do this lying down is find a corner, and you want the sharp part of the corner. And you're going to stick your head on one side of the corner and then leave your shoulder behind on the other side. So it looks like is this. So see how the pointy part of the corner is directly on top of my shoulder? I don't have it on the bone. I have it on the muscle, the squishy part of the muscle, because we don't want to be massaging out the bone. We're wanting to massage out the upper trapezius muscle. And you use your feet to press into the floor. And so your knees are bent like that. And you're just pushing your shoulder into the corner, hold this position for 1 minute at least. And if you come away from it, you still feel a lot of tension right here, then you can repeat it again. And I like this lying down position because you can fully relax. You can just put your head on the ground, chill out, maybe the other side by moving your head to the other side of the corner like that. So now the sharp part of the corner is directly on top of my shoulder again, like that, and then just hold it for another minute. And if you feel like it's not enough pressure, again, use your feet to push into the floor with your knees bent so that you can drive that corner into your shoulder. And that really is pretty effective for a lot of people, I've found, to reduce tension in that upper trapezius muscle. And incline your body like that so that your upper shoulder is on the corner. Now as you do this, you want to make sure that you don't have the corner on your bone, because you don't want to massage at your bone. You need your bones there, so you want to make sure that it's on the squishy part of your muscle as you're doing this. And then you just use your feet to apply pressure into that corner. And you just hold that position. This one can be a little more uncomfortable for people's backs, so usually I go for the one where you're lying down. Also, you're having to hold your head up, so you can't fully relax. So that's why I recommend the lying down version out of the two. But if you're in a pinch, you don't have a place you can lie down, then you can do this version as well. And then you would do, if you have problems with both shoulders, you can just switch the other side like this. And you want to make sure that you sustain that hold for an entire minute, because if you don't hold that whole minute, then your muscles just don't have time to relax. Because if you're clenching your muscles all day long, it's going to take time for them to just relax. So that's why it's really important to make sure you spend the time and stay in that position for at least 1 minute. And if you recheck and you still have tension, then repeating that again. So this exercise is going to either be sitting up or lying down. So I'll show you the seated version first. For seated, you just pull your head straight across like that, and that's gonna stretch the upper trapezius muscle along the side of your neck, and then you would hold that for 30 seconds, 2 to 3 times. And it's really important you do hold that for that whole time because you're trying to disengage those stretch receptors that are holding the muscle tight in place. So holding it for an entire 30 seconds, 2 to 3 times. If you want more of a stretch, you can put your hand behind your back like this and just pull and hold. And for this seated version, you have to hold your head up. So a version I like better is actually to lie down. So when you're lying down, you're just pulling your head across to one side and looking straight up at the ceiling. So this is going to stretch all those muscles along the side of your neck, and then you don't have to hold your head up. So you just chill out in this position for 30 seconds, 3 times. Okay, so get into position. Here we go. 30 seconds. So just pulling your head across to one side like that. And you want to make sure that you keep your chin straight. So as you're holding this position, a lot of times what I see is that people either pull up their heads like this, or they might turn their head. And that is still a stretch, but then when you turn your head like that, or you lift your head up, you're actually getting more of your levator scapula muscle, which is another muscle in your neck, which is okay, but we're trying to get your upper trapezius. So for the upper trapezius, you have to purely side bend. So no rotation, so you're looking straight up at the ceiling for this one. You want to hold for an entire 30 seconds and try to relax. Feel that muscle lengthening. You don't want to feel any sharp pain or stabbing pain. It should be a gentle pull with no pain as you're holding this position. Okay, then we're going to switch the other side. So just pulling straight across like this. And looking straight up at the ceiling. Remembering to have a gentle pull with no pain. So here's what it looks like from a distance. So as you can see, I'm not turning my head with rotation. I'm just looking straight up. This is a pure side bending motion. And we'll just keep holding this position. Again, gentle pull with no pain. You don't want any sharp stabbing pain. And this is lengthening those muscles that get so tight. The upper trapezius muscles in the front, on the tops of the shoulders, tend to get really tight. Here we go. Just pulling straight across. Try to relax. You should feel like the second time you do this, it's a lot more comfortable because the stretch receptors are starting to relax. Stretching is not a quick fix. You have to take time with it. But this is so helpful to reduce pain and get rid of that clicking sound. Okay, and then switch sides again. So that clicking sound that you hear is from nitrogen bubbles and carbon dioxide bubbles that get caught in the what's called the synovial fluid of your facet joints in your neck bones. So when that fluid gets the bubbles and you move your head, then suddenly the bubbles get released and it makes a little pop, pop, pop sound. Another cause of that popping, okay, then we're going to switch again. Another cause of that popping is when you have tight muscles, then they turn into like guitar strings because they get so tight that they go over the bony processes, specifically the transverse processes in the bones of your neck, and that creates like a strumming of your muscles over your bones, and so that creates that snapping sound that you hear sometimes. And then we're going to switch one more time. So if you're having a lot of that snapping or popping, the fix for that is to relax those really tight muscles and also to strengthen the appropriate muscles to stop the air from getting inside of your facet joint synovial fluid. So these exercises are so helpful. I've noticed I've probably worked with hundreds of people who have gotten better from these exercises. So that's why I'm sharing these with you because they're so good. Okay, so hopefully your upper trapezius which of the muscles right here that go up into your neck feel a lot looser after the massage as well as the stretching. So now we're going to focus on another muscle. This one is the levator scapula. So for this one, you put your hand over your head and then you pull your head to look into your armpit. So like this. And so now you are rotating. You want your nose to be going into your armpit as you do this. And if you want more of a stretch, you put your hand behind your back like this and just pull and hold. So you can do this lying down. This is one earlier I showed you so when you're lying down, for the upper trapezius you pull straight across, and then for this one you rotate and look into your armpit. So either you can hold this seated or you can be lying down when you do this. So lying down it would look like this. Just rotating your head to look into your armpit. We're going to go for 30 seconds. And I'll show you guys a more close-up view of that. So you want to pull your head and look into your armpit like that. And that's another muscle that gets really tight and contributes to neck pain. So we're isolating each individual muscle so that you can relax all the muscles that get tight. Okay, and then you'll switch to the other side. And just hold for 30 seconds again. And we're doing 3 times 30 seconds. Again, you should feel a gentle pull with no pain. Switch again. So if you were to pull past the point of pain, then you can actually create tears in your muscle, and that's normal to get tears in your muscle if you're exercising, but right now we're stretching, so we don't want to get those little tears in the muscle. We just want to slowly elongate the muscles. And again. One more time on each side for a total of 3 times 30 seconds. Hopefully your levator scapular muscle feels a lot more relaxed at the completion of this exercise. Okay, so for this next stretch, we're going to be stretching the scalene muscles. These muscles are in the front side of your neck, and they connect the first and second ribs. So when they get tight, like really tight, then they can cause numbness, or they can compress the subclavian vessels in your neck as well as the brachial plexus. And also, if they're really tight, when you rotate or when you side bend, you can get that clicking sound because it's like a guitar string going over the bones, and so then it creates that sound. Also, because the scalene's attached to the first and second ribs, If the scalenes are tight, it can actually make it hard to have full thoracic expansion, so that breathing becomes more difficult. So these muscles are super important to make sure that you have them loose, and a lot of times people haven't stretched these before, so it's a unique experience. It might feel a little bit weird at first. I know it did to me when I first learned about these stretches, but we're going to go ahead and go for the stretch. So you're going to find your collarbone, and then you're going to put your fingers just under your collarbone, and then you want to push in and pull down. And you see these muscles here in my neck popping up. That's how you know you have the right position. You should feel stretch along here, and then you're going to lean your chin up and away like that. And we're going to go for 30 seconds, and you should be feeling just a gentle pull with no pain. No sharp stabbing pains, no numbness. If you feel any of those symptoms, then drop your chin down a little bit more, or don't pull down as hard. If you feel just a gentle pull with no pain, then that is exactly what you want to be feeling. Okay, I'm going to switch sides. Again, finding your collarbone, pushing in and then pulling down, and leaning your chin up and away. As you're holding this, you don't want to be shrugging your shoulders up. You want to keep your shoulders down and back. And just a gentle pull with no pain. Okay, so the next exercise we're going to do is neck circles. So we're going to go for 30 seconds. Just rolling your head in one direction. And you want to go slowly. You don't want to be going super fast. That can make you dizzy. So nice and slow. And if you have that cracking sound, that's the nitrogen or carbon dioxide bubbles in the synovial fluid of your facet joints in your bones of your neck. So that's just those bubbles releasing. This can usually be fixed with more strengthening of your appropriate neck muscles. Okay, we're going to go the other direction. And the other frequent cause of neck snapping or popping is really tight muscles going over the bones of what's called the transverse processes of your neck, and that's just like they turn into a guitar string. They get so tight when they snap over, so that can also be fixed by stretching of the tight muscles and strengthening of the weaker muscles in your neck. Okay, so for this next exercise, you're going to be lying on your side, and you're going to touch the side of your head to the floor, and then bring your head to the side like this, and we're going to go for 1 minute. So it's like a sideways crunch for your neck, and you want to make sure that you're keeping your head back, so not bringing your head forward. You want to keep your head back as you go up and down like this. And so now we're relaxing the opposite muscle group by reciprocal inhibition. So we're strengthening the muscles right here in the side of your neck. At the same time, the muscles on the other side of the neck are getting to relax and be lengthened. So this exercise is really good for strengthening and stretching the opposite muscles at the same time. You want to go slowly with this one too. You don't want to be going too fast. And you're also just bringing your head to the side. So we're not rotating at this point. We're just doing pure side bending for this exercise. Remember to keep your head back. You want to feel a little bit in the front of your neck. If you start feeling the back of your neck, then you'll know you're sticking your head forward. I'll show you the side bending motion with resistance. So you take a band and you wrap it around your head just above your ears, and then secure the band to the floor. And then you're going to touch the side of your head to the floor and then bring your head up. Notice how my hands are staying on the floor. So I'm not raising my hands up with my head. I'm keeping my hands on the floor as I do this, and I'm also keeping my head back. So not allowing my chin to come forward, and keeping my head back the entire time, and just raising and lowering my head like this. So we'll go for 1 minute. this is just side bending, so you don't want to rotate at all. You want to look just at the wall in front of you. And you should definitely feel an achy soreness in your neck, but no sharp pain. This will probably be pretty fatiguing when you first start doing it, but then as you do these exercises more consistently, you should notice that cracking sound and the fatigue starts going away. Also, you start having less neck pain. And so we just did lateral flexion or side bending of the neck, so now we're going to do rotation. So for rotation, you're going to hold your head up the entire time, and then just rotate and look up, and then rotate and look down. So again, keeping your head back, not letting your head come forward. So we'll go for 1 minute. So keeping your head back and rotating up and down, like this. And also you want to make sure that you're not lifting your chin too far off your chest and extending like that, because then you'll start feeling the muscles in the back of your neck, the neck extensors. And you want to, again, be feeling it more in the front, because those neck extensors are already really strong usually from looking at a screen. If you have your screen too far forward or down where you have to bring your head forward, so we want to strengthen those muscles in the front of the neck by keeping your chin tucked towards your chest. Good job. And then 10 seconds left here. And I'll show you the progression for this exercise. So the progression would be using a band, and then you wrap the band around your head just above your ears, and then you keep your hands on the floor. So it would look like this, and then just holding your head up, and then rotating looking up, and rotating looking down like this. So we'll go for 1 minute. You can choose without the resistance or with the resistance. Remember to keep your head back and not bring your head forward. And you're holding your head up the entire time. So for this exercise, you're going to need a towel, and you're going to lie down on your back with your knees bent, and you want the middle of the towel around the back of your neck, and then your hands clamped together at your forehead. So as you're doing this, you want to make sure that you're pulling away from your feet, so towards the wall behind you, closest to your head. You're not pulling up like this. So you're trying to imagine like you're pulling your own head off. So you're going to pull and hold for 5 seconds, and then relax, and then pull and hold. So we're going to go for 1 minute. Okay, so you're going to pull and hold for 5 seconds, and then relax, and pull and hold. So what we're doing is separating the bones in your neck slightly to allow more space for those intervertebral joints. So this could be pretty comfortable. Sometimes people will get a crack in their neck from this. That's just that carbon dioxide and nitrogen bubbles in the synovial fluid of your facet joints in your neck coming out. And you shouldn't feel any sharp or stabbing pain when you do this. It should be a gentle pull, no pain. We're just elongating those muscles. Sometimes people will feel a stretch in their lower back, and that's good because then you you know you really have a good anchor there and you're pulling and relaxing all those muscles all on your spine. 5 seconds and then relax. But make sure you don't do this if you have a neck fracture. In fact, you shouldn't be doing any of these exercises with a neck fracture. The next one I'm going to have you guys do is chin nods. So for this one, you can either do it without a ball, and you're going to be on your back with your knees bent, and then you're tilting your chin towards your chest for 3 seconds, and then lifting your chin off your chest, so like this. And as you're doing this, you want to make sure you're not lifting your head up. You want to keep your head on the ground as you're doing this. And so that's the version without the ball. If you want to add a ball, it should be a firm ball about this size, so you can use like a tennis ball or a lacrosse ball, works well. And then you place it around on one side of your spine, right here. And then once you have the right placement where it is on your muscle and not in your bone, then you're going to lie down on the ball and then turn your head to one side, like that. And then you're going to nod up and down. This version I like better because then you not only get a massage, but you also strengthen these muscles here. So choose either the version without the ball, where you look straight up and nod, or the version with the ball, where you look to the side. And we're going to go for 1 minute. So you should feel tired in the front of your neck as you're doing this, because we're strengthening those deep neck flexor muscles, the ones that help to keep your head back, so that your ears are over your shoulders. Because when they're strong, you don't even have to think about keeping your head back. It just happens. And at the same time, if you're doing the ball technique, you're also massaging out those neck extensor muscles that get really tight. So these muscles work as a pair. So these muscles tend to be too weak, so that's what we're strengthening. And the muscles in the back tend to be too tight. So that's what we're working on massaging right now. You guys do the other side. So you'll move the ball to the other side of your spine and then rotate and look towards whatever side you have the ball on and then nod up and down. Or if you're doing the non-ball method, you'll just do another minute looking straight up and nodding like that. So here we go for 1 minute. So the next exercise we're going to do is called chin tucks. So for chin tucks, you're looking straight ahead, and then you just bring your head straight back, like give yourself a double chin, and slightly forward. You don't have to really stick your head forward. You just want to do slightly back and neutral. You want to imagine like you have a book on your head, so you're not tilting your head up or down like the last one. This one, you're just simply bringing your head straight back and neutral. And you also want to keep your shoulders down and back, so not going like this. You want to keep everything back and down. And then the band, if you want to add it around the back of your head, it adds more resistance. It also prevents you from tilting your head up or down, because if you tilt your head up or down, see how the band slips. So this way, you just bring your head straight back and neutral. So we'll go for 1 minute. for this exercise, you're going to be on your hands and knees, and then you're going to be looking at a spot in between your two hands here, and then just bring your head up and down, and you're not lifting your head like that, because then if you do that, you're going to engage these muscles in the back of your neck. So you want to keep your chin tucked in and just bring your head up for 3 seconds and down without lifting your chin off your chest. So we're going to go for 1 minute with that one. So remember to keep your chin really close to your chest. If you feel like this one is too easy, then you can add a band around the back of your head, just above your ears here, and then bring your head straight up and down. And I like the band version because not only is it more of a challenge, but also prevents you from having the incorrect form. So if you were to lift your chin off your chest, see how the band slips towards your neck, then you know that you're not doing it correctly. So it forces you to have the correct form by keeping your chin close to your chest as you do this. And you should feel it in the front of your neck and not in the back of your neck. Because again, we're trying to strengthen those deep neck flexor muscles. Okay. So that was just the straight up version. We're going to be doing the rotation version next. So you can either do it without a band if you don't want resistance. So you're going to keep your chin close to your chest, bring your head up, look left, center, right, center, and back down. So that's without the band. If you want to add the band, it's the same motion. You just put the band above your ears, bring your head up, left, center, right, center, and back down like this. And that again will prevent you from cheating with this motion because you can't lift your chin off your chest. You have to keep your chin tucked in towards your chest. I'm going to go for 1 minute. Here we go. So you're using your hands to secure the band to the mat. So for this next one, you're going to grab a towel and you're going to put it around the back of your neck, and then you're going to either pull down and look up for 5 seconds and then repeat, or pull forward and look up for 5 seconds and repeat. Okay, so we're going to go for 1 minute. So if you feel like it's better when you pull down and look up for 5 seconds, and then look ahead for 1 second, and then pull down, look up for 5 seconds, and then look ahead, you can do that version. Otherwise, you can pull straight ahead, look up for 5 seconds, 1 second looking straight ahead, pulling forward, looking up for 5 seconds, and then straight ahead. So the towel's acting like an external muscle to help assist the muscles with this motion of looking up. Trying to relax those neck extensors. Looking up, and 1 second looking straight ahead. Alright, so the next one I'm showing you can either be done in a seated position or a lying down position. So with a seated position, it looks like this. You have one hand straight down to your chest, the other end comes over your mouth like that, and then you pull and hold for 5 seconds, and then without moving your head, you switch your hands and pull and hold. So as you're doing this, you want to make sure not to cross your hands across your neck like that, because then you're cutting off blood supply to your brain. Your carotid artery goes up there, so you definitely don't want to be doing that. So to stay safe, you need one hand straight down your chest, not coming across your neck, so straight down. Other hand is over your mouth, not at your chin, and certainly not below. You want to keep it over your mouth, and then you pull and hold for 5 seconds, and then without moving your head, switch, pull and hold. So we're going to go for 1 minute with this exercise. So that's the seated version. If you want, you can lie down and do this, because then you don't have to hold up your head with your neck muscles. So you're on your back with your knees bent, one hand comes straight down your chest, and then you pull and hold with it over your mouth like that. And then you switch, pull and hold like that. And you just keep switching. It should feel pretty good. So your neck muscles aren't doing much work. It's just your hands pulling your head. So you just want your neck muscles more along for the ride. This is assisting that motion. And the reason you have your knees bent is to help protect your back if you've chosen the lying down version. I find the lying down version to be more effective of the two. Alright, all done with that one. So next exercise we're going to do is lying down, face down, and you can either do it without resistance or with resistance. So if you choose without resistance, the motion looks like this. You want your forehead on the floor. You're going to bring your head straight up for 3 seconds and then down. You want to keep your chin close to your chest, like this. And if you're not sure if you're doing it correctly, you can take a ball and put the ball under your chin like this. And then if the ball stays put, then you'll know you're doing it correctly. So you can do it that way, or you can do it with a band. So you put the band around the back of your head, just above your ears. And then you bring your head straight up for 3 seconds and then down. So choose whichever version you would like. We're going to go for 1 minute. Here we go. Go and get started. And you should feel it again in the muscles in the front of the neck and not in the back of the neck. So the band, and then also feeling the muscles in the back of your neck, those are the 2 ways you know if you're doing it correctly. Because with the band, if it slips like that, then you know you did it incorrectly. The band should stay put above your ears. And then you'll know you're keeping your chin close to your chest. And also you want to make sure you're not shrugging your shoulders up. If you're holding the band, you want to keep your shoulders down and relaxed. Okay, so then the next one is the same motion, but now we're going to add rotation. So you're going to bring your head up and then look left center, right center, and back down. So either without the band, looks like this, up, left, center, right, center, and back down. Or with the band, up, center, right, center, and back down. Here we go for 1 minute. Again, keeping your chin close to your chest. Up, left, center, right, center, and back down. 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 next exercise, you're going to be leaning your head to the side, and there's a few ways you can do it. You can either apply pressure to the side of your head with your hand, and then you want to lean your head into your hand, so your hand's pushing your head's pushing your hand like that, and then you switch hands like that, or you can use a band. So you'd wrap the band around your head like that, and then lean to the side, holding for 3 seconds, and then back up. And since it's just inconvenient to switch the band, we just stay on one side if you use the band. And whatever version you want to do, we're going to go for 1 minute. So if you're doing the band version, it looks like this, and you want to keep your head back. So if you're doing the hand version of applying pressure and then switching, we'll do 1 minute twice. So you will get the full resistance workout for your neck. So now we're doing that reciprocal inhibition again. So you're strengthening the muscles right here, at the same time you're stretching the muscles on the opposite side. And you want to make sure you keep your shoulders down and back, so not shrugging up or bringing your shoulders forward. You want to keep everything back, including your head, so not sticking your chin forward. You want to keep your head back as you do this. Just bringing your ear towards your shoulder. Okay, and then switch the other side for 1 minute. Arm might start to feel tired, and that's just a bonus workout. Just as long as you're not shrugging your shoulder up. You want to keep it down and back. Okay, for this next exercise, we're going to do rotation. So you can either do the hand version where you apply pressure to one side of your forehead and then rotate into your hand and then switch, or you can use the band, put the band around your forehead and then rotate over each side. So we're going to go for 1 minute with this exercise. And as you're doing this, you want to make sure that you're not sticking your chin forward again. You want to keep everything back, your shoulders down and back, your head back. Everything stays back. So again, if you're doing the hand version, it looks like this. So your hand's pressing your head and your head's pressing in your hand. It should not feel easy. You want to feel it like a moderate difficulty level, but no sharp or stabbing pains. If you feel any sharp or stabbing pain, then definitely do less pressure or just discontinue the exercise. Your head back and your ears over your shoulders. Alright, we are all done with that one. Alright, awesome job guys with all those neck exercises. Hopefully you feel really tired right here in the front as well as in the sides of your necks, and hopefully you feel more stretched out in the backs of your necks. Let me know if you guys have any questions about anything we did. But thank you so much for doing my neck exercise routine. See you guys next time. Bye.